Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Continuing from our previous videos on angina pectoris and myocardial infarction, this lecture will focus on the differences in handling these conditions in dental care. Many students find it challenging to distinguish between the management of angina and myocardial infarction in a dental setting, which can result in serious clinical consequences. For patients with angina, it is important to know their history to avoid triggering an episodes. Reducing anxiety is key, which can be done with good local anesthesia and sometimes using nitrous oxide. You should also limit the amount of epinephrine and local anesthetics to prevent putting too much strain on cardiovascular system. During the procedure, continuously monitor the patient's vital signs to detect any early signs of distress. Always have a nitroglycerin ready to use in case of an emergency. Now we have a look on dental considerations for MI patients. For patients who have had a myocardial infarction, you need to consult their physician, especially with the first 6 months after the event. Ideally, elective dental surgery should wait until after 6 months unless their physician clears them for early treatment. It is also important to check their current cardiovascular status like irregular heartbeats or heart failure. Review the patient's medication, particularly if they are taking blood thinners. It is crucial for planning the procedure. Reducing anxiety is important, just like with angina patients, and you must monitor their vital signs throughout the procedure. Consider providing supplemental oxygen based on patient's needs. Let's highlight the key differences in the management of angina versus myocardial infarction patients. The timing of dental procedures differs between angina and myocardial infarction patients. Angina patients can often proceed with treatment if proper precautions are taken. However, for myocardial infarction patient, it is better to wait for 6 months unless their physician gives the go-ahead sooner. Pre-procedure consultations for myocardial infarction patients are more detailed and often involve discussion with their physician. When it comes to medication, angina patients focus on nitroglycerin use. In contrast, myocardial infarction patients may be on various anticoagulants, which need careful review because it affects treatment planning. For emergencies, always have fresh nitroglycerin nearby for angina patients and for myocardial infarction patients. Keep both nitroglycerin and supplemental oxygen available if needed. To sum up the key differences in managing dental treatment for angina and myocardial infarction patients involving the timing of procedures and the need for detailed pre-procedure consultation. Angina patient can often proceed with precautions, while myocardial infarction patients usually need a longer waiting period unless their physician approves earlier treatment. Additionally, medication considerations are different, with the angina patient focusing on nitroglycerin and myocardial infarction patients needing a review of their anticoagulant medications. Emergency preparedness is also crucial, with the nitroglycerin always on hand for angina patients and both nitroglycerin and supplemental oxygen ready for myocardial infarction patient. Understanding these differences is essential for ensuring patient safety and effective treatment outcomes. Thank you. Wish you best of luck.